Started. So welcome everyone to Mental Wellness and COVID-19. What's gender got to do with it? This is part of our Distant Not Disengaged event series. My name is Kim Regala. I use she, her pronouns, and I am part of the SFU Public Square team, one of the hosting organizations of this event. Before we begin, I wish to acknowledge that I am physically joining this conversation as an uninvited guest on the unceded traditional territories of the Coast Salish peoples of the Kikai and Coquitlam First Nations, and that the organizations that host these distant, not disengaged events do their work on the unceded traditional Coast Salish lands, including the Squamish, Tsleil-Waututh, and Musqueam nations. This territorial acknowledgement serves only as a small gesture towards reconciliation, but it is a crucial step nonetheless. And acknowledging the territories that we are physically joining from allows us to recognize the long-standing burden that Indigenous people have undergone from being disconnected from their own land. So as we converse today on the topic of mental wellness, I encourage everyone to take a moment to also acknowledge the importance of this relationship to land for Indigenous people and all people as part of their wellness. And for anyone who wants to know more about the Indigenous land that they live on, we recommend checking out Whose Land at www.whos.land. Okay, so for those of you who have been to a distant, not disengaged event before, welcome back. Feel free to introduce yourself in the chat if you haven't already, and let us know what events you've been to. Actually, I encourage everyone to maybe introduce themselves in the chat. What's your name, your pronouns, and the land that you are joining us from. And for those of you who haven't been with us before, Distant Not Disengaged is an online community event series launched in response to COVID-19 and the issues and inequities that it has surfaced. It is designed to help people connect even as we physically distance from each other. And this is actually our final event of the series, or at least of this year. So since April, we hosted 17 events, sometimes weekly, ranging in conversations about grassroots responses to COVID-19, caring for our elders through this time, the overdose crisis, reimagining public engagement, and so much more. This is a collaborative project organized by SFU Public Square, SFU's Morris J. Wask Center for Dialogue, and City Hive. And for today's event, we are so thrilled to be partnering with the Gender and COVID-19 Project at SFU to spark a dialogue about the gender disparities in mental health outcomes during this pandemic. We welcome you to loop into the conversation online as well with the hashtag distant not disengaged and sign up for our newsletters to stay on top of all of our upcoming events and projects. So some community guidelines before we get started. Above all, there will be zero tolerance for those who promote violence against others on the basis of race, ethnicity, national origin, sexual orientation, gender identity, religious affiliation, or different ability. And anyone who incites harm towards others will be removed at the discretion of our technical team and moderator. Please be as present as possible. Put your phone down, pause your notifications, and please join us in engaging in this very crucial dialogue. And we hope that you can turn your video on for breakout rooms, which we will have in just a moment. But please turn your videos off as our speakers are talking to keep the focus on them. We also invite all of your questions and comments in the chat box throughout the session. And if you have a question for a specific speaker, type an @ and their name at the beginning of your post, and we'll work to direct as many of those to them as best as we can. And then we also ask that you don't assume pronouns, gender, or knowledge based on someone's name or video image. You can simply refer to people using the usernames that they provide. Step up, step back. If you've asked a question or shared a comment, ensure that new voices are heard before contributing again. And lastly, please practice self-care. If you need a break, a glass of water, or some fresh air, please go for it. Some of these conversations can be difficult, so please do whatever you need to do to look after yourself. And a final reminder, closed captioning is available, so you can turn it on and off by clicking the CC button at the bottom of your screen. And in just a moment, when we head into the breakout rooms, if you do need closed captioning there, please remain in this main room first before joining so we can get you set up. And a big thanks to AI Media for partnering with us to provide this service. Again, this event is being recorded and will be made for viewing shortly after. So our event today is structured pretty simply. In just a moment, you'll all be sent to a breakout room with a handful of other guests for a quick 8-minute chat to introduce yourself and, if you'd like, to share what coping strategies you've used to try to maintain mental wellness. Each breakout room will have a facilitator from our team to help get these conversations going, and you are welcome to participate as little or as much as you want. Conversations about mental wellness can be difficult, so we have an active listener for today's event, Elodie Jacquet, who will be available at any point if you need support. And you can find her by her username, Elodie, she, her active listener. So if you'd like to access our active listener, please return from our breakout room and private message Elodie. And then after that, we will reconvene and I'll hand things over to our moderators for today's discussion, Dr. Julia Smith and Professor Kelley Lee, who will take it from there. They'll introduce our speakers and moderate a discussion with them and you about how gender relates to unequal mental health outcomes under COVID-19 and how intersectional gender-based policies can prevent and address these inequities. And with that, I think we can start the breakout rooms. So welcome back, everyone. Hope you enjoyed getting to know some of the faces in the room. Now, if you wouldn't mind, if you could please just turn off your video by clicking stop video at the bottom left of your screen, just so that we can limit any of the distractions from our speakers. And yeah, with that, it is now my privilege to introduce our moderators for today. We've got Dr. Julia Smith and Professor Kelley Lee. Thank you so much for joining us, Professor Kelley Lee and Dr. Julia Smith. Now, Dr. Julia Smith is a university research associate in the Faculty of Health Sciences at Simon Fraser University. She co-leads the Gender and COVID-19 project, which is conducting research on the gender effects of COVID-19 in 9 countries, with the aim to inform gender transformative policy responses. Also moderating is Professor Kelley Lee, who is a Tier 1 Canadian Research Chair in the Faculty of Health Sciences at SFU, Fellow of the Faculty of Public Health Royal College of Physicians, and Fellow of the Canadian Academy of Health Sciences. She is a Senior Advisor on the Gender and COVID-19 project with long-standing expertise in global health governance. Dr. Julia Smith and Professor Kelley Lee, thank you so much for joining us, and please take it away.
Thank you so much. Thank you to everybody for being here today. As mentioned, I co-lead the Gender and COVID Research Project, which is really quite a big project and quite broad. So when SFU Public Square reached out and asked about this event, we started brainstorming a theme or a focus. And in the process, we started talking about mental wellness, and we thought this was a great theme to focus on because it fits so well within the distant, not disengaged kind of ethos. And what I was seeing in the research I was doing, and also seeing in other research from around the world, was much higher levels of stress and anxiety, particularly for women. The gender-based analysis I do is also about noticing gaps. And one of the gaps I was really noticing related to the experience of trans and gender diverse people. All the data I was seeing was only looking at this difference between men and women. And it was quite simplistic, not looking at the intersections even of those identities. And so I thought this event and this panel was a great opportunity to bring together people to discuss how gender norms and inequities affect mental wellness and how we can address those. And so I'm absolutely thrilled to have this great panel together and to learn from them through this conversation. And so I'm going to start by introducing them kind of in the order that they will be speaking first, and then I'll pass it on to Kelley. So we're going to hear from Sekani Dakelth, who is a volunteer with the Catherine Home Wellness Center. She's a member of the Frog Clan of the Dakelth Nation. She comes from a long line of matriarchs that are claiming back their power, is passionate about women's rights, two-spirited rights, and how to apply these passions to the health and safety of sex workers and folks that are affected by drug use. She has experience in the downtown east side, the place where she grew up and came to know herself. Lucas Wilson is a care team coordinator with TransCare BC, a program of the Provincial Health Authority. He has worked in numerous roles directly supporting trans and gender diverse people, particularly in the context of gender affirming care access. He coordinates a health navigation team that supports trans and gender diverse people of all ages, as well as their care providers, family, and community supports. Genesa Greening is President and Chief Executive Officer of the BC Women's Health Foundation. She has served as a member of the Prime Minister's Women Deliver National Council and on the advisory board of the Institute of Gender and Health at CIHR. She is an award-winning business leader, an unapologetic feminist, and a relentless optimist driven to change women's experiences in the healthcare sector. Bina Salimath is a member at large of the Vancouver Women's Health Collective. She is a counselor and anti-violence sector and mental health first aid instructor. She uses a decolonial lens in all that she does and tries to contribute towards making the world safer where and how she can. Alvaro Luna is a mental health program specialist with the Health Initiative for Men, Vancouver's queer men's health organization. He's a psychotherapist and currently coordinates the counseling programs and serves as the connection point between the organization and community. I'll hand it over to Kelley now.
Thanks, Julia. What a fantastic panel. Thank you, each of you, for giving your time today to join us and share your knowledge and experience. So I've been given the task of just really asking you the questions, and please, give us your thoughts on these. So the first question that I'm posing is, drawing from your own experience and work, how is COVID-19 affecting mental wellness? And please do draw upon your understanding of the effects on people of the genders that you work with. So I'm going to call first on Sekani.
Hi, everyone. So right now, I just wanted to clear something up. I'm not a volunteer for Catherine White Holman Center. I'm just, they asked me to come here because they wanted to really amplify Indigenous voices. And I was suggested by two folks that work there to kind of speak on this issue. And maybe I can say a bit about my experience. So I do a lot of my work from experiential knowledge that I've gained through my lived experience, through doing sex work and being transgendered, and then later changing that to two-spirited, and really feeling like where that fits and is in line with myself and with my community. So, and in my bio, I mention, women's rights first, because I feel like that's where a lot of my things have started, like watching how, watching my grandmother and my mother, because I come from a long line of matriarchs, seeing how they lived and how they thrived through very challenging times, and what they've done to make it through to today, to carry me forward and to carry the rest of my family forward to this day. And here comes my cat. No. But the reason I wanted to start there is because I feel like a lot of issues that I've grown to advocate for within the downtown east side was social acceptance of transgendered femme folks, and where we can find ways to, like the work that I've done at Pace Society. I'm currently working at Megaphone right now, facilitating and doing workshop development. But what I notice is that a lot of things, especially now, like COVID, see, there she is again. No. God, that cat just throws me off. Should lock her up. But yeah, just one of the things that I've noticed through this COVID that has really changed for folks that I've walked beside, the people that I consider my sisters, which is a lot of trans femme folks that are currently doing street-based survival sex work, which is where I started as well. What I've noticed is that there was definitely, it was so hard for a lot of us to get in the door to many places like shelters and to the Women's Center. And there are a lot of things that we had to do in order to get past those doors and past the people who are kind of gatekeeping. And I noticed that through COVID, a lot of those places have shut down. So there isn't a lot of places that folks who are are trying really hard to present more feminine. Like, for example, folks are having trouble getting razors, like just a simple razor to be able to shave if they need to, if they want to, something that makes them feel better about themselves and to present more easily. Um, and just simple things like that that I found um, so like basic to someone like me, because I have a lot of privilege right now. I've lived in a place for 7 years. I've had work. I'm able to maintain wellness with a lot of support from my family and my community, which is something that I know a lot of people didn't get. But something as basic as a razor couldn't prevent somebody from going to access services, even though those services right now are just at the door. You know, like, if you want lunch, for example, some places will just be, you can come to the door, you can't even go inside. And then being able to use the bathroom, some places I know community centers have opened it back up, but I'm trying to take it back to when we first hit, just so that people know when something like this happens again, things to prepare for. You know, like having little kits. I remember the first work I did with Prism, and we were doing workshops like Trans 101 workshops for detox and shelters and stuff. And we encourage them to put together little packages for folks who might want to present more femme, you know, like putting a razor and putting some lotion and maybe a little bit of makeup if they have it in a bag you set aside for somebody who might be struggling to present. And just some basic things that we have around can go a long way with people. I noticed that even just having a little bit of lipstick or foundation for myself when I was homeless was just so amazing to be able to put that on and to go, okay, I feel a bit better. My anxiety is reduced. I can go into this place and access the shower and access other services that I needed. I have 1 minute left. Can't believe that was 4 minutes, 5 minutes already. Whoa. Um, but I just want people to be aware that, like, right now we're going through challenging times with services, because there's a lot of new waves of acceptance. Like, for example, there are folks, it's okay not to shave, you know, and still be feminine, but at the same time we have to think of where we're fitting in and how other people feel, because I feel like this is one thing that's never said. It's a privilege to be enlightened enough, to be stable enough, to be enlightened enough to grow, to accept other people. So for women that are still struggling very much and at the margins and being beaten and raped daily by men on the street, it's it's really hard to be in that state of survival and to grow, to say, okay, well, you have to accept somebody else for who they are. To me, that's like, it's a privilege to be enlightened, and you have to be stable to get there. There's no way that anybody can get there if their basic needs aren't even met. And by basic, I mean housing, food, and shelter. Shelter, I mean a home, because a shelter space is something that will make people safe and get them off the street, but it is not a home. So in order for us to have enlightenment and acceptance, we need those things. So I want people to be gentle with each other and to call, instead of calling people out, call people in, and to just acknowledge that, you know, yeah, just to make those acknowledgements is really important. And I've noticed that it's the work that I'm doing that's at the core of this, because not a lot of people are talking about that. And right now the whole wave of acceptance is like, no, you have to. But then we forget about, you know, like people like my mom or my grandma and people who are just struggling daily. And it's like, well, this is the reason that I got into this work, was for them. But now how do I fit myself into that situation, even coming from the same background, right? So be gentle, be nice, consider each other. And I think that's the minute. Thank you.
Thank you so much, Sekani. That's really important information and a lot to think about already. And we will come back to those points. Those are really important. So thank you. Our next speaker is Genesa. You have your 4 or 5 minutes. Thank you.
Thank you very much. I want to acknowledge that I'm coming to you from the unceded territories of the Squamish, Tsleil-Waututh, and Musqueam peoples. And Sekani, thank you so much for speaking to us today. And I feel very fortunate to be invited to these spaces and to give you a little bit of a sense of kind of what we're seeing. And I work for an organization that specifically works in the women's health equity spaces. And we've been paying a great deal of attention to what we're here to talk about today, which is the mental health impacts of this pandemic on women and their health and their access to health. And as you can imagine, specifically looking at women, which Kelley asked us to speak to the gendered spaces we specifically work in. We've got some realities that are continuing to compound the general impacts of the pandemic. And we know that at the beginning of the pandemic, the majority of job losses that were experienced in British Columbia were experienced by women. We noticed that the public health measures that were put in place that were absolutely necessary to keep the general public safe were also disproportionately impacting women. So things like shutting down of childcare, daycare, schools, leaving women to really take a heavier responsibility for the childcare and caretaking responsibilities within their families. I heard in the breakout groups, folks talking about what it meant to kind of balance life with kids at home while still having to execute on whether or not it's direct job responsibilities and working from home and the challenges that came from that. Folks might not know that prior to the pandemic, the unpaid care work that is being done by the women in this province works out to 6 million hours a week. And so if you think about what that looks like now that the pandemic has happened and we're taking on increased responsibilities for our immediate family and our children, and in some cases our elderly parents, that's only going up. And unfortunately, it's not being equally shared across the folks, across genders within households. And all of these things do lend themselves to poor mental health outcomes. We've seen a substantial increase in depression and anxiety and stress since the beginning of the pandemic. And so we've been doing work ourselves with the Women's Health Research Institute that works across the province looking at kind of the data and research in women's health research spaces. And we actually did a survey of 1,000 women here in British Columbia, and 41% of women felt they could not get access to the mental health supports that they need right now. And I think, Sekani, you spoke eloquently about kind of it's really quite simple sometimes what people need in order to feel valued and well and included and seen. And I think that plays itself out across the gender spectrum around right now. It really isn't just about if you're well or not. It's being seen as making sure you actually have someone to talk to, somewhere to go, somewhere to get those resources. And folks are really struggling with finding those right now. And as we continue to see these increased levels of anxiety and depression, these moments, even like the one that we have right now, is equally as important in feeling connected and having opportunities for people to hear their stories being reflected back to them from other folks is part of that process. I know that for myself, I'm a single mom to a 4-year-old boy who was basically sitting on my lap for the better part of 6 months at the beginning of the pandemic while I was working full-time from home. And I had to, at one point, admit that this was too much. I was struggling and it was very hard. And I have resources. As Sekani mentioned, I have a home, I have a job, I have meaning in my life, and yet I was struggling. And so taking a moment to think about those folks that are in your circle who might not have some or any of those particular resources, and recognizing how important it is that we stay connected. And then you think about our healthcare workers right now, and 4 out of 5 healthcare workers in the province of British Columbia are women. And we anticipate continuing to see increased depression, anxiety, and impacts on them as they struggle with what it means to leave their families, go to work, be exposed, and then vice versa, go home and be worried about those exposures, but also seeing loss and challenge every day in their roles and responsibilities. And so we start to see all of this data coming through, and the challenges that I know folks are seeing, Julia spoke to this at the beginning, is we're not getting segregated data. We're not getting the data that's racialized. We're not getting the data that talks about trans folks. We're not getting the data that's talking along the gendered spectrum and the non-binary folks and folks that deserve to be counted in these statistics so that we can actually develop a response to these realities. And so it's absolutely essential that we continue to have these kinds of conversations as we look to develop meaningful interventions for people to manage these challenging times and this isolation as we move into the second wave. And so encouraged by conversations like this as we start to identify ways we can create responses to ensure people's mental well-being during these times. Thank you.
Thank you so much, Genesa. That's so important. And your information is really helping to make visible what has been quite invisible. A lot of the work, just counting, just being aware of these issues is so important. So thank you so much for that. Next up, we have Bina. And I know Bina's got a lot to contribute as well. Hi, Bina.
Hi, everybody. I'm Bina, and I work as Stopping the Violence counselor with an organization in downtown Eastside. And one of the things that COVID has brought or highlighted for me and for us as an organization has been like, I work with the philosophy like it is in the shelter of each other we live. And for many of my women, this shelter has never been a safe space, even before COVID. And this pandemic has just highlighted and magnified how unsafe systemically this shelter is for majority of the women I work with. These are women who have left or have been impacted by violence in their life at any point in their lifetime. It could be developmental violence or it could be current violence in the relationship. And stepping back to March when the lockdown happened quite dramatically, so many of the women who were in unsafe relationship, it suddenly was, home became a very unsafe space. Some of the women I work with had made their life with their husbands or spouses being away at work. And so during the time the spouse was away, they attended counseling sessions. They took care of their needs. They took care of, they're able to just breathe easily. But when the work moved on to remote and the violence came home and there was no respite from it. So it was a really hard and intense time for us. And shelters as well, transition places and shelters, they were overbooked. And plus, the women the intersectionality of health and COVID restrictions, women who suffer with respiratory disorders or women who had other health issues that made them at risk, shelters and transitions were not a safe space for them to go either. So it was just a very, up to June, it was such an intense time for many of the women I worked with. I remember taking calls at 9 o'clock in the night sometimes and going to meet them for a walk somewhere in the park so they could just get the little break and in-person connection. And the other part that we have noticed, especially in the beginning stages, was the legal system. Quite a few of my women don't have custodial rights, or are not the primary custodians of their children, and they see their children in MCFD places or under supervised visits. And initially when COVID restrictions came, so many of these places that they used to access to see their kids under supervision were shut down. So that also meant that they were not able to see their kids at a time, and it also misused by their violent partner as well. And the legal system was not open at the time until they introduced that emergency legal respite, where they started doing back order of supervision rights. It just like, it again highlighted to us how the marginalized are impacted quite dramatically when these kind of pandemic restrictions come home. And the other area that was has been hit is access to medical system. I know telehealth is available, but for quite a few of my women who don't have access to either safe home or don't have access to technology, telehealth is not an option. For some of my women who work on the streets, they develop relationship with their caregivers. They just pop into the care point and see the caregiver and get a nurse practitioner and get what support they needed. But now with telehealth, it was just not an option. Either they did not have a safe home where they could call in, or they didn't have the technology. And that was really a very, that is something that is still ongoing. And I want to highlight that as well. And one of the other areas that, surprisingly, what I learned from my women were some of my women who are in the sensory disorder, or they said that the pandemic was an excellent time for them, because they didn't have to interact with the outside world. They didn't have to, they could limit their contact and how much contact they had. And when they went out, the grocery lines were no longer as busy, so that was a surprising gift of pandemic to some of my women. I want to highlight that as well. What else have I seen? Genesa was mentioning closure of the childcare system, closure of support system, also meant that women had to take on the extra load of taking care of the children. It also meant some of my women, and this is what I noticed, like some of my racialized women were the ones who left the job earlier on, not being able to maintain, or they were not met with as much receptivity in their employment to be able to rework the schedule. And most of these women did not work where the work could be moved on to remotely. That's again a privilege, being able to work remotely. They needed to be in person. They were in caregiving roles. Some of my women who worked as in household, providing in-care support, they were let go from their jobs because they could not be there, or they had kids. They could not bring the kids to the households. Or one of my women who works in retail, she could not bring her kid with her while she was in the retail industry. So there's a lot of hardships. So the intersectionality of the greater the marginalization, the greater the impact of mental health, the greater the impact of COVID on mental health has been. And then other area that I've noticed with women is frontline workers. With nurse practitioners as well, it has been quite hard for them to be able to deal with a number of patients they've been seeing in a day, the volume. So that's pretty much what I have to say today. It is to be mindful that not everybody has a safe shelter to begin with.
Thank you, Bina, so much, and for just giving a voice to those women that you work with. I think it's incredibly important, and how we're seeing a layering of issues here. But the intersectionality, I think, comes through really very clearly from what you've just said. So thank you so much for that. Our next contributor is Lucas. So hi, Lucas, you've got the floor.
Hi there, thanks so much. So I just want to say, I think a lot of what I'm going to cover has already been covered by other folks as well. I think that a lot of different folks from different identities are sort of sharing in a lot of the same challenges to do with COVID. I work primarily with transgender, diverse, and two-spirit folks, as well as their families and caregivers. So that's sort of the perspective I'm coming at it from. And I first want to acknowledge that I think COVID has affected, as a pandemic, has affected basically each and every one of us in some way. So I think folks who may not have had previous experience to do with challenges around mental health or just general well-being are feeling this pandemic. And I think that in of itself says a lot about how folks who have barriers to care, who are part of marginalized identity groups who face multiple oppressions, especially intersectional oppressions, are coping with the pandemic as well, because it's that baseline difficulty that we're all experiencing, or most of us are experiencing in some way, and then layers on top of that they were already dealing with, in the way that the pandemic is affecting all of those individual oppressions and barriers that folks were experiencing before. I think about, and Bina mentioned this a bit as well, just the way that the pandemic has also enhanced access to care for some folks. I think in terms of virtual care, it's now possible where it wasn't before for a lot of folks, say in rural, remote communities, to connect with care, because most services have now gone virtual, where that wasn't possible before. I come from healthcare, so previously a lot of healthcare telehealth was available, but you had to go to a clinic or hospital to access telehealth. Now, most doctors' offices, many services that are medical for a lot of care, are able to just do that directly with clients in their own homes, which for some has been enormously helpful in that it's cut down their need to travel for care. So that's just been an interesting impact I've noticed. I think it's the pandemic has forced us to utilize technology and that we had all along and start using it, and also to build technology and systems that I think have been helpful. In that same respect, I think the way that we're expecting people to now access resources works for some, but does not work for a lot of folks. Thinking about folks who don't have access to technology, been mentioned before. For me, what I think of as, in terms of my work, is that for a lot of transgender, diverse, and two-spirit folks, they may not live in situations in homes where it is safe for them to disclose their identity, to talk openly about their identity. And for a lot of folks, they were really depending on those out-of-home office spaces, providers they could go visit to speak about their identity and to explore those topics. Doing that from home can present a lot of issues where that person doesn't have a safe, confidential home from which they can speak about what's going on for them. So in terms of mental health, that's something that I've encountered with a lot of my clients, is that the services are certainly there. I mean, not as much as they should be. Obviously, access to free counseling has long been a barrier for many folks. There are limited resources, but where they are there, those aren't necessarily accessible resources for all folks. Thinking about youth comes to mind for me. A person who may be at home may be needing to talk about gender-related topics with a provider, but I mean, if they're home and their parents are home, then where do they find space to do that? And so that's been a difficult thing to navigate with clients, whereas previously they could have gone to a doctor's office to do that. I do also and know that in the pandemic, folks have just, the need for mental health support has certainly increased. It's always been there for the population that I support and work with. Like, mental health is certainly in high need and in lower supply than ideally it should be. But of course, the pandemic has just augmented that need and has also limited some of that supply, and that the services we have access to have expanded in a lot of cases their catchment, as long as you have the resources to connect in that way. But some services have also been shut down or slowed down, which has changed the care landscape for a lot of folks. And I think that's about all I have to touch on that hasn't been so well touched on by all the other speakers. So maybe I'll just close up there, but thanks for allowing me to speak on this topic.
Thank you so much, Lucas. And no, that's all very valuable. Don't worry about, we have to amplify these messages. And I think it's coming from more than one person. This is really important to hear. And the healthcare issue is one that I don't think we're hearing enough about in terms of the inequities you're describing. So really appreciate you bringing that to our attention. Okay, so our final member of the panel is Alvaro. And to see if you are there. And then, thank you, hi. And then we will come back with a second question. So over to you.
Thank you, Kelley. Okay, so, well, thank you everyone who has been sharing. I think that some of the issues that you've mentioned is something that we've seen as well with the population that we work with, which is gay, bisexual, and other queer men. What we have seen in terms of applications for our counseling programs and our mental health support is an increase in substance use, anxiety, and some other forms of distress that we have heard from community reports. And also they kind of like are consistent with some of the findings of the Canadian Mental Health Association, where we have seen increased substance use during the pandemic. Some of them, we have seen some of the numbers of overdoses that have been happening particularly in our area. And yeah, so that's one of the main things or presenting issues that the community comes to us and tells us we're struggling with this. So substance use, anxiety, and some other forms of distress. For example, part of what the Canadian Mental Health Association has indicated specifically for queer men has been the increasing report of behaviors of self-harm, which also kind of like coincides of the levels of distress that we're hearing from community. We have been also hearing a lot of isolation. And I think this goes in line with some of what Lucas was sharing about queer folks who may live in households where their families may not be supportive of their queer identity, may find community outside of that home. And then, with the restrictions in going out, the restrictions in place, some of these folks may not be having access to their community physically. Something else that I wanted to mention was we did see a dramatic increase in applications for counseling around late April. We think that this may have been related to kind of like when the pandemic started. If we think about it in terms of disaster responses of communities, there was kind of like this, in the beginning, there was this kind of like hopeful response, a lot of messages on we're in this together, we'll get through this. And then as the pandemic continued, we saw kind of like a decrease in that hopeness, and then it became kind of like a hopelessness feeling. We think that many of folks in the community were trying to prioritize some other things like economic security, housing, and other priorities like that. And then by the end of April, people started really feeling kind of like the loss of those queer spaces, of their regular activities, and started looking out for counseling. So that's what we have seen. There's two main things that, or two particular things that I think respond to some other intersectionalities within our population, and it's younger queer folks or folks who are not out in their households, whether it's with families or maybe roommates that are not aware of their queer identity, who may not be having the access precisely to privacy, to access, for example, online services. One of the things that we have done in our counseling programs has been allowing for telecounseling. But then what we have realized is that there are many folks in our community who do not have access to a private space. So even if we can offer, you can talk to a counselor via Zoom, they don't have a room where they can have the privacy to speak. So that is one thing. Also, well, and this is particular for queer youth that we have seen, and also folks that are not out. And let's remember that in terms of outness is not necessarily a binary where you're out or not. You can be out to some people in your household. You can be a bit more out in certain settings. So there's some complexity there. Let me see what else we have here. Also, we have seen reports of higher distress and isolation in older queer folks. So, for example, a lot of older gay men who live by themselves, who report a lot of isolation resulting from the restrictions in social gatherings. For example, a lot of our folks who used to be in the gay bars constantly, and that was a lot of their social life has been severely restricted, and also not being able to access a lot of the resources that have been made available online. We see some older folks who don't have a computer or don't know how Zoom works or how to create an account and this type of thing. So they need kind of like that extra case management or extra involvement. And what else? And yeah, also, you know, in terms of, I think in our community, we, under the organizations like him, we try to be, and we really believe in sex positivity, and we believe sex is healthy. So there has been a lot of issues that the community reports to us in terms of, you know, folks who were having very active sex lives, having to navigate, again, the COVID-19 restrictions. The organization, we have put together some kind of like tips and guidelines for folks with harm reduction focus for folks who want to have sex. For example, one of the things that we're recommending is, you know, if you're going to have sex, try to identify 1 or 2 people that you feel the most secure with, and having to, you know, having some of those prevention things in place, but at the same time not sending the message of like, you cannot have sex, right? So I think those are some of the things that we have been seeing from community, and some of the reports that we have seen with our population. And yeah, I think that's pretty much it. I'm not keeping track of the time, so I'm not sure if everything is good with time.
Okay, I think Seth is keeping an eye on the time. I think it feels about right. And if you can think of something else, you've got a second chance to add anything in that you've forgotten. So maybe I'll move on to that. But thank you so much. And you know, it's just yet another, I think, great example of how communities are so disrupted by this pandemic, and communities that are really, you know, can't connect as well, are disrupted by all sorts of things, and there's consequences for that. And I think that's really helpful to hear, you know, what you've described, Alvaro, in terms of the queer community. So thank you very much for that. So keep these thoughts. I mean, we've heard from 5 really important perspectives, and how I think a lot of us take for granted some really basic things that are not happening for a lot of people out there. And so I think the second question is really important, because of course we need to acknowledge these experiences and understand them and value them. But we would welcome hearing, you know, what can we do? What can we do to kind of ease some of that, you know, that burden in terms of service delivery, policy responses, community action, and really, you know, focusing on mental health. What can we do to improve mental health? And you are the 5 perfect people to ask, because you know this, what are people experiencing? So if you could speak about the communities that you are part of or you work with, that would be really helpful, although I'm not going to constrain you to that. So we're going to go in a different order this time, and hopefully this won't come as a surprise. So I'm going to call on Lucas first and ask him to share what are some of your ideas about what we can do.
Sure. So yeah, I really, for me, I've been thinking a lot about accessibility of services. I'm always thinking about that, but for me, that's really top of mind when it comes to our current situation. And thinking about the ways that I think we've already made, we've done a lot of work in the pandemic to make services more accessible in a different way for a lot of folks in a very short amount of time. So for me, that proves we can do it, which is good news. I think we just need to consider having the same level of dedication to improving accessibility over time and for all populations as we have in this short amount of time where we made things more accessible. Sorry, I'm getting possibly another voice in there.
Yes, I had one too. No, keep going, Lucas.
Okay, cool. So thinking about, we're doing a lot of virtual care right now. Are there ways to bring about other forms of supporting people, even if it's more challenging to arrange that, right? So trying to be really creative about the ways that we're reaching out to people and allowing folks to reach out to us in terms of providing service while still maintaining safety. I think about an example of, for a youth who wasn't able to talk to support providers in their home. They were trying to reach out to a number of providers, and it just wasn't possible given where they were living and what they were wanting to talk about over the phone, which would have put them at possible danger within their home. They weren't out as being trans, and were very worried about the implications of their parents finding out, which is unfortunately not an uncommon experience. So there was work between a number of the youth providers to help arrange for them to come to a space that was a youth serving office, and so the youth could come to that space and could use the computer there in order to reach out to their care providers that they weren't able to see in person because the offices didn't allow it. So in that case, kind of really bringing together a circle of care around that person and figuring out how can we make this work, how can we cobble this together based on the resources we have access to really bridge this person to care. So thinking about if a person can access like virtual, is it possible to do phone, right? Is that going to be easier for that person? Is it possible to arrange an in-person visit if safe, right? Like, is that possible? Is that possible in, say, like another office if the office that they usually see folks at isn't available? So thinking a lot about accessibility, making services more accessible, and not just in, I think, the way that works for a lot of folks, but thinking about everyone, and how accessibility needs really differ depending on the individual and they have access to. I also think a lot about, during the pandemic, just, I think from where I come from, access to care outside of just mental health care, right? Knowing that mental health is connected to so many aspects of our lives. For me in the work I do, a lot of folks I work with who are transgender versus two-spirit are accessing gender-affirming healthcare. So that means access to vital care they need. This may be hormones, this may be surgery, it may be neither, it may be both, it may be something else entirely, but how that's, for the folks I work with, really, for transgender diverse folks in general, it can be quite closely connected to a sense of mental health and mental well-being, and how that's not, I think there may be sort of a misconception that care is somehow optional or isn't sort of life-saving or vital, but we see that it is, and we see that this care is life-saving, this care is vital, this care really impacts folks, and when they have access to it, we do see an increase in terms of a person's mental health and well-being overall, and their ability to move through the world in the way that that fits them best and allows them to do what they need to do to take care of themselves. So I think thinking also about maintaining access to needed healthcare. From my perspective and my work, I'm going to speak specifically to gender-affirming healthcare.
Thank you, Lucas. I'm going to actually leave there, but those all seem possible things. They don't seem, outrageous by any means, and we're certainly adapting on a lot of fronts. So that seems like a very reasonable and possible thing to do. I'm going to try and squeeze in everyone else. So thank you so much. We're going to, I think, go to Bina now, and I think I've been told that we have like 5 minutes. Is that right? It's my fault. I lost track of time.
About 10 minutes to go.
10 minutes? Okay.
Yeah.
So we can call in everyone. I really do want to hear everyone's ideas for how we can move forward. So Bina?
I'll keep it short, make it 2 minutes or less than a minute if I can. But if I go over, just feel free to show that card to me. Firstly, I want to acknowledge that I was really quite surprised with how fast the community mobilized to take care of the needs. And we as an organization at DTS, we rely a lot not only on government aid, but also community support. And with the food, with the hygiene, with sanitization, we got a lot of donations. And we were able to meet the needs of the community through that, as well as the serve. The way it was done also helped a lot of my women that I saw. So first I want to acknowledge that. Now, past the acknowledgement, I want to bring forward what is not necessarily my input for the pandemic, but also generally. Trauma-informed and decolonial policies towards racialized folks should be coming not from a colonial mindset. The epistemologies that are fed into the trauma-informed approach do not really serve racialized folks. There should be a broader consideration of other epistemologies. What Sekani was saying earlier about that spiritual connection what I've seen in the pandemic is physical health was given was almost compartmentalized and given importance, while the mental health and well-being was not considered. And that has played a lot of role in actually decreasing the immunity of the women that I work with and putting them in unsafe situations that could have dire straits more than the pandemic itself, more than getting COVID. So something that I want to bring forward is, to broaden the epistemologies that are considered in shaping COVID or any other service policies. And in the DSM-V is a manual that counselors use to work with what they deem as mental health patients. When anybody comes with paranoia or hypervigilance, we are told to work to lower down the hypervigilance. But as a counselor working with women who are now living in violent situations, hypervigilance is not necessarily a bad thing to have because it keeps you safe, it keeps you aware of what is going on. So I had to rethink my way of approaching trauma. It is looking at what are the gifts of hypervigilance? Why is it hypervigilance necessary now? More so because many of the women were living in unsafe home situations and external supports had become very limited. So that is something to consider. And again, it comes back to using indigenous knowledge and knowledge from different cultures to feed into developing policies. And reproductive rights as well. Some of my women who were pregnant during the time and did not want the pregnancy to go through did not have access to options work. And what was available later on was online only. And again, it comes back to accessibility, where online makes it accessible for a lot of folks, where privacy and safety is a concern in the home situations. Online does not serve the needs. So maybe a different, yeah.
And those are all very important points. And again, I think very doable.
I think so too.
Just being aware is the starting point, but all these things don't seem very outrageous to me. We just need to be aware that we need to do them.
So and we can do it. The pandemic has showed that we can do it.
We can. Yeah. Absolutely amazing what we can do.
Yeah.
All right. So the next up, Sekani, we're coming back to you. You've said some really important things about just really, again, really basic needs that we don't seem out of reach. So how do we fix this? How do we do better?
Well, one thing, I'll just make it really short. One thing I think notice that a lot of folks have touched on is technology. And I do attend a group that I've been eating with trans folks for the last 15 years. We've been meeting every Tuesday, and those meetings have become online. They're still delivering us lunch and food hampers every Tuesday, which is amazing. So I still feel like I'm eating with folks, even though we're not eating right. It's hard to eat over Zoom. But we're able to meet, and I noticed that some folks don't have a really good camera on their phone, or their camera doesn't work, or their phone doesn't work right. If people have like an extra phone kicking around, maybe consider donating it to a service that is hosting groups online, so that people are still able to connect through these tough times. And I love what Bina said. It's not the answer to everything. Maybe make options like taking a walk. Like I take walks with my counselor. We're able to stand apart, but we choose a safe, relatively quiet area to walk in is really important. And then one other thing, I want to touch on policy. I started my work at PACE, and they met with us over policy. All our peer workers, we were included in every staff meeting. And I think there's something really important in knowing who you serve, and when you're making big changes to your policy and your procedures and how you run your business, is to know who you serve and to ask them. Ask them questions like, how can we serve you better? How can we change policy to better treat you like a human being rather than, just someone else that walked through the door? So know who you serve, folks. Thank you.
That's great advice. We can't assume who we're serving. We need to get out there and ask people what their perspectives. So thank you for reminding policymakers of that. Alvaro, you're next up, please.
Thank you. And I will follow kind of like what Sekani was mentioning. Thank you for that. I think that is one of the main things of knowing who you serve, that we have thought it's been like the most helpful thing. For example, I think the main suggestion that we would make in terms of increasing equity is to have equity focused initiatives. For example, what we've noticed and what we hear from the community is like there are some folks who don't have access to privacy at home, and that's a reality, period. So how can we address that? For example, what we did at HIM was like we decided to allow in-person counseling exclusively for prioritizing people who didn't have access to privacy at home, or for the technology to do it online. So I think that is what will give us the answers. It's ask the people we serve what is going on, what do we need, what are the complexities, and then make it happen by implementing equity-focused changes in our programming, and that's for organizations. And yeah, I really like the know who you serve idea, in the sense that I think it is necessary for us to conduct not necessarily research, speaking like academically or like strictly research, but just even if it's conversations, like having hearing the community reports, make note of what we're seeing, that the populations we work with, what are their needs and what is that is getting in their way to get mental health support, and implementing that into our programming. We the last thing that I wanted to share is we have done those changes in our programming where we allow in-person counseling for folks who have accessibility issues or have, in terms of technology or privacy, at their homes. And we also have put together some infographics where we give folks some suggestions or ideas to cope with all the stresses and the anxiety that comes with the pandemic, and that is available on our website as well. But yeah, I think that's one of the main ways in which we can address these issues.
Wonderful, really practical stuff. And I keep hearing these equity issues. We really need to be very mindful of equity in all sorts of ways. Thank you so much. And then finally, but not surely, it's Genesa. Sorry, Genesa, I haven't forgotten you. Wanted to get you back in there. Hi.
Thanks. And I just want to thank Alvaro, Bina, and Sekani and Lucas for sharing today. And for us, we do work a lot in the policy spaces. I actually worked in the downtown east side for 10 years. And for us, one of the things that we're really committed to advocating for is changes to policy and practice, so that the environments that you folks are working in that are on the panel are being given the resources that you also need to continue to grow on the innovations that we've seen during these times, and hopefully learn something from that. And I think what we're hoping for is a gendered approach to healthcare, some considerations of looking at racialized women, Indigenous women, new immigrant and refugee women, which we've not really touched on here as well today. Those that are being pushed into the margins, who are, in sex work or actively experiencing gender-based violence, or living in poverty, have uncertain living environments, those living in rural and remote areas. We've talked about all of those today, and we really need an intersectional approach to our healthcare provision, and mental health falls within our healthcare system. And so we really need a perspective, as Sekani said, of not for us, without us. And so making sure that those that we've spoke about today are being brought to the tables as we learn from these moments, to hopefully create sustainable policies and sustainable programming and access as we move forward. And for us, we really are hoping that we can get better at learning the data and hearing the stories, and making sure that our health systems reflect those unique healthcare needs. And I'm encouraged by conversations like this as a part of that process, and look forward to continuing these conversations in coming weeks and months as we make some of those recommendations.
Thank you, Genesa. This has been a really important conversation, and we could go on for hours, I know. But I know that there's people who are keen to ask questions. So I'm going to have to pass it over to Julia, but I really enjoyed the session so far. Thank you all again. A great panel.
Thank you, everyone. This has been an amazing conversation. I actually think that we might just be completely out of time because we're at 1:15. So I'm just going to say thank you so much to everyone. I think what we've really heard is that people are facing lots of challenges, but also coming together in amazing ways to support each other and to help their communities. And I'm very grateful for all of you sharing your knowledge with me and the rest of us today. So with that, I think I'm going to pass it over to Kim.
Sure. Thank you so much, Julia. And thank you to everyone for this really important conversation. Of course, thank you to Dr. Julia Smith, Professor Kelley Lee for your great moderation. And thank you to our speakers, Sekani, Genesa, Bina, Lucas, and Alvaro for those wonderful insights. Really grateful to have listened in, and I am definitely coming out of this with so much knowledge and empathy for folks who are facing these different barriers based on their genders. And on behalf of the teams at SFU Public Square, SFU Morris J. Wask Center for Dialogue, and City Hive, thank you all for joining us. We will be sending out a follow-up email shortly with the links and resources referenced in these conversations, as well as a short video to help us adapt and sorry, not a short video, a short survey to help us adapt and improve these events. We will also be sharing a video though and a blog post of this event. So please keep an eye out on our social media channels and sign up for our newsletter to stay updated. And yeah, that is the end of this event. Thank you again for everyone joining us today, and we hope you enjoy the rest of your day. And thank you to the team who have kind of carried us through all of these wonderful events throughout over the course of the summer and since April.